The future belongs to creative doctors. Having both secondary, paramedic, and higher, physician, medical education, I began my work in medicine at a time when logical thinking and an individual approach to each patient were still required from every link in the chain of medical care. Modern realities, due to established standards and treatment protocols, have come close to the concept of paramedicalism, even more so than in the Soviet era. This implies a guaranteed minimal approach to each patient. Unfortunately, for some doctors and their leaders, it has become the maximum, without taking into account that there is not a single patient who is exactly the same as another. Even with identical diagnoses, each person has their own pain threshold, metabolism, and so forth. A simple example: prescribing the same dosage of medication to an adult patient with different weights, and so on. The future of medicine, as in the distant past, lies in an individualized approach to the patient. This is evidenced by the development of gene therapy and 3D printing in medicine. A banal example of this is the use of innovative technology in vascular surgery. Just recently, the Commonwealth Scientific and Industrial Research Organisation of Australia became the first in the world to master individual three-dimensional printing of vascular stents. These stents are used for the treatment and prevention of acute vascular disasters that lead to fatal conditions such as strokes and heart attacks, as well as gangrene of the limbs and intestines. Previously manufactured stents, although available in various materials and sizes, were standard and did not take into account the individual characteristics of the patient's circulatory system. Now, thanks to 3D printing, it has become possible to create these complex devices with geometric precision, allowing for the expansion of the vessel diameter to match the required size according to the individual anatomy in each specific case under the guidance of a surgeon right during the operation. For me, this is further confirmation that being a doctor is indeed a more creative profession, despite the efforts of governing bodies to reduce it to mere craftsmanship.